Support for Consider This is provided by the University of Nebraska at Omaha College of Communication, Fine Arts, and Media.
Consider This, a program of issues and information behind today's news.
Cause for concern, but is it cause for alarm? Hi everyone, I'm Kathy Wyatt. Welcome to this week's edition of Consider This. Our topic, the Zika virus. Joining us to talk more about it is UNMC's Mark Rupp. Dr. Rupp is professor and chief in the Division of Infectious Diseases. Thank you so much for being here and welcome to the program.
Thank you. It's a pleasure to be here with you again.
All right, we've heard a lot about this, right? How is it that you're defining the Zika virus?
Well, the Zika virus is something that your viewers probably haven't seen a lot about or heard about until very recently. It's a virus, however, that we've known about for several decades. First got described back in the mid-1940s in Uganda, and it's named after the forest in which it was discovered, so the Zika forest. And many of these viruses have a name somewhat analogous to where they're discovered. So a lot of your viewers remember about a year ago we were talking about the Ebola virus. So that was named after the Ebola River in the area of Africa where it was discovered. So many of these viruses have that kind of a name of a geographic location. It's a type of virus that shares a lot of characteristics with what we call the flaviviruses. This is the yellow fever virus, dengue virus, chikungunya, some of these other kind of what many of your viewers would think of as sort of exotic diseases in tropical locations. Most of them are spread by vectors like mosquitoes, just like the Zika virus.
Okay, now you mentioned it, but let's talk a little bit more about how this did originate back in the 1940s. Go ahead and take us there. We have some video we're going to put up while you're talking about that.
Sure. So again, we've known about this virus for a number of decades, although it's not really been very eventful or very impactful throughout the world. So it was first described back in the mid-1940s from its isolation in a monkey in the Zika forest in Uganda. The first human cases were described in the 1950s, mostly in sub-Sahara equatorial Africa. And then it kind of spread from there throughout the tropical areas of Asia, Southeast Asia. Some of those areas were having sporadic cases. And then it really came to the fore probably about 10 years ago, kind of in the middle of the last decade, when there were some very large outbreaks in Micronesia, French Polynesia, and then from there has finally spread now to our corner of the world in the Western Hemisphere, and it's had an explosive outbreak, as your viewers know, throughout South America, the Caribbean countries, and really spreading quite widely in those areas of warmer equatorial Western Hemisphere now.
Yeah, let's provide our viewers then with a visual. We do have a map, and we want you to talk specifically about where this virus is active right now, and then we'll kind of whittle our way into what we should be thinking about here in the United States.
Sure. So your viewers are looking at a map now of the world, and as you can see, the real hotspot shown by that magenta or purple area is all through the western part of the world where it has most recently come to the fore. So this is a virus that we really didn't know was in this part of the world until about a year ago, and then has spread very, very rapidly from that time. It changes on almost a daily basis now, the number of countries that are listed, and as of yesterday, there were 26 countries listed throughout most of the areas of South America, the Caribbean, Latin America, that now have documented spread of this virus.
Dr. Rupp, for those people who are wanting more information about a topic like this one, CDC, where else can they go for good information other than you, of course? Very busy, but where else would they go to find some accurate, up-to-date information?
So as you mentioned, I think the CDC is a very responsible body to give public information, and the public health service in general. So they are really weighing this carefully, examining things carefully, releasing information in a very timely fashion. So they've been keeping up with this at its very rapid pace of evolution. But if folks go to the CDC site, they'll find the most up-to-date information. The World Health Organization likewise has been very active in this. I think they learned some lessons from the Ebola outbreak, and so they have discussed this, and they've declared this what we call a public health emergency of international concern. This is kind of the highest level of concern that they can place upon a disease. Triggers a lot of scrutiny, a lot of effort to contain it, and so the World Health Organization would be another great place for people to find information. They can go on to the internet easily, just go to the CDC site or the World Health Organization site, find an awful lot of really accurate, up-to-date information.
Yeah, stuff like that though also triggers fear, and sometimes unnecessary fear. Let's talk specifically about the United States, right? So tell us Zika virus in terms of how concerned we should be here in the U.S.
Yeah, so as you mentioned in your lead-in, this is something that we do need to be aware of. Do we need to have great concern? Is this going to have an impact on us here in the United States on a day-to-day basis? Probably not. I mean, this is something analogous to chikungunya virus, which we talked a little bit about again in the lead-in. Another virus that has come into our part of the world, the Western Hemisphere, very, very recently, spread radically throughout the islands of the Caribbean and in some areas of South America and Latin America, but really hasn't had much impact on day-to-day life in America. We're not going to have the person-to-person spread via these vectors that we have in other parts of the world. Part of that is just because the mosquito population and how far it spreads, depending upon the level of climate, the warmth, and the amount of moisture, as well as some other things, as well as our lifestyle. So we're not living in crowded, ghetto-like conditions with no screens on our windows, with no air conditioning. We just don't have the same kind of conditions that we might have in other parts of the world where they're going to see the spread of this virus via mosquitoes from person to person.
Yeah, we opened with a video of the mosquitoes. How much weight do we really give? That can also be something that's concerning to people. You know, there are folks now talking about how they don't ever want to be bitten by a mosquito because, of course, of things like the opening video. So how concerned should we be about that in terms, broad strokes, in terms of all of this?
Sure. So there are lots of mosquito-borne diseases in the world. As the lead-in showed, malaria being the primary disease that's spread by mosquitoes. But in this part of the world, in Nebraska in particular, you know, a decade ago we were facing big outbreaks of West Nile virus that was spread via mosquitoes. Now the reason that that virus was so readily spreadable here in this part of the country was that we had a big reservoir for it. So West Nile virus was active in the birds and other animal populations, horses and other mammals. And so the mosquitoes had this large reservoir of animals that were infected that they could then pick up the virus and spread it to humans. That's not going to be the case with Zika virus. There are no other animal vectors that we have here, or animal reservoirs. So we're not going to see that reservoir population that allows the mosquitoes to feed and then spread from person to person. Really, the only reservoir we have are people. So if we don't have a lot of infected people, there just isn't going to be mosquito spread of that virus.
Yeah, as you're talking, I'm thinking about maybe viewers who haven't seen an interview that we've done with you before and maybe thinking, how on earth did this man get involved in this particular realm? Would you mind just giving us a little bit of your background at this point in terms of how you did come into be where you are today?
Well, sure. I'm sort of a jack of all trades, I guess, and a master of none. So being in infectious diseases, we do get interested in these diseases that spread, you know, like Zika or like Ebola or what have you. And so, you know, it's part of our duties to try to inform the public and try to put all this information in perspective. So the University of Nebraska Medical Center has a large division of infectious diseases. I'm very, very pleased to be in that division and help to lead a really a great group of talented people as we look at a whole lot of different infections.
And
Zika just being one.
But you were drawn to this how though, doctor? You could have picked a lot of different options here back in the day, and you decided to go down the path of infectious diseases. Why?
Well, I think most infectious disease docs find a fascination with the microbiologic world. And so I share that characteristic. I kind of love the microbes. I like to understand them, their reservoirs, how they're spread, and what we can do to prevent those.
So when I ask you something like, tell us the symptoms, for example, of Zika virus, That's very interesting to you. So go ahead and have that be of interest to us. What are the symptoms then when it comes to the Zika virus?
Well, the main thing to realize about Zika virus is that the vast majority of people who contract this illness have no symptoms. It is totally asymptomatic. So about 80%, 4 out of 5 people who actually get Zika infection will never know it. They're totally asymptomatic. Now the other 20% typically have a very, very mild disease. So sometimes a little bit of headache, a little bit of joint achiness, muscle achiness, a little bit of rash, some redness of the eye, some fever. That typically goes away within just several days. So it's generally thought of as a very mild disease. That's part of the reason why it really just hasn't been of great interest to the medical community up until now. The real worrisome part about this is that it has been now linked to some birth defects, microcephaly.
Okay, and we do have, before we show pictures there, I do want to talk a little bit about then, if we don't show signs or symptoms, how do you diagnose it then?
Well, it is a little bit of a tricky diagnosis. First, you diagnose it clinically, and it looks fairly similar to some of the other diseases that we've already talked about. So chikungunya is a new virus that, again, is just in this part of the world, in the Western Hemisphere over the last couple years, looks very similar to that. So same kind of symptoms. Dengue fever also can look very much like this. Even malaria can sometimes be confused with this. So there's a lot of other tropical diseases that look very much like Zika. Mm-hmm. And then you can even have some other things, flu or measles or something like that, that can be confused. So clinically, it's kind of a tricky diagnosis to recognize. The real test that we do to make the diagnosis is usually a blood test that's done in very specialized laboratories. So we really send all these tests now to the CDC. I think that'll change probably here in the near future as they start having public health labs like the one at the University of Nebraska Medical Center start to be able to do these tests. But right now it's very specialized testing to confirm the diagnosis.
Wow, you mentioned microcephaly, and we do have some photographs. As we're putting those up for our viewers, talk to us a little bit about what that is and how it's linked.
Yeah, so microcephaly is really aptly named. It just means a small head. And so there's evidence now that is coming increasingly that this virus is linked to microcephaly. It's not completely proven, but there's a fair amount of circumstantial evidence and association that infection with this virus while a mother has a baby in utero can lead to this, can be devastating birth defect called microcephaly. Now, it doesn't appear to happen very frequently in infected mothers, but apparently does occur to some smaller degree. Now, in Brazil, they have described several thousand cases of microcephaly during this outbreak of Zika virus. Now, we have to understand that microcephaly occurs at a low level anyway. And it's in the data in the United States, we think it's somewhere around 2 to maybe 10 or more infections, or not infections, but birth defects per 10,000 live births. So if you just do the math, we have about 4 million live births in the U.S. every year. You look at that somewhere, let's say 5 per 10,000, and now we're talking about several thousand cases of microcephaly that just occur at sort of the baseline. And the same thing happens in Brazil, obviously. So trying to figure out, have we seen a big upswing in this versus just a level that's in the baseline is a little bit tricky. But again, the data suggests that this virus is associated with microcephaly. Now, this can be kind of a range of effects on a child, everything from a devastating, very limiting kind of condition to something that isn't so bad. In its worst manifestations, the children can be very intellectually challenged, developmentally delayed. They may have trouble feeding. It can really limit the rest of their lives. Other people have less of an effect from it.
Okay. Any other birth defects that are associated, potential birth defects with?
Well, from what I understand, and I'm certainly no expert on the birth defect field, but it appears that in these cases of microcephaly, you can also have calcifications in the brain, showing again there's been a lot of inflammation, a lot of damage. There's some eye findings, so that some of these children have problems with their vision, problems with their hearing. So there's just really a whole spectrum of manifestations of this microcephaly. And then we may get to it as well, but there's another very unusual neuromuscular disease that has been linked to these outbreaks of Zika virus called Guillain-Barré syndrome. And that can occur in the adult population that gets infected with it. So again, the major thing we're worried about is in pregnant women, but other people who get infected with it, there is some low level of what we call Guillain-Barré syndrome.
Okay, what is that? You can go into that a little bit more if you'd like.
Sure. So Guillain-Barré is, again, a very rare neuromuscular disease that's characterized by ascending paralysis. So people have some sort of trigger for it, and there's a number of known triggers for it, some of them being infectious diseases, and many times we don't really know what's caused it. Causes a ascending weakness or paralysis. So people start having weakness and decreased sensation in their feet, legs, and it kind of ascends upward. And in the worst cases, they can actually be paralyzed from it. Typically, it's treatable, and over a period of time, sometimes months, a lot of that function comes back. But again, it's a serious illness, very mysterious, triggered by other viral illnesses, some bacterial illnesses, many times totally unexplained, that we see now some signal that Guillain-Barré can be associated with Zika virus. Again, some of these things are changing on almost a daily basis as we gather more data on this topic.
I can't imagine how you stay on top of all of that.
Well, it's a bit of a trick, but I try to maintain the knowledge base.
And then you're called at a moment's notice to explain how it all shakes out, right?
Well, we try to put it again into the context of what people need to be aware of and concerned of. Again, I don't think that this virus is going to affect people in the United States on a day-to-day basis for some of the reasons we talked about. We do have a little bit of the mosquito population that spreads this in the southern Gulf Coast area, Florida, Georgia, all along the Gulf Coast, the Aedes aegypti mosquito. We also have another mosquito that's seen in this area of the country called the Aedes albopictus that can spread this virus. But we don't really think that this is going to be a problem here because we don't see the same sort of climate, we don't see the same sort of mosquito spread of many of these other diseases. So for instance, we don't have outbreaks of dengue fever here in the United States. We didn't see a big outbreak of chikungunya fever this past year in the United States. We don't have transmission of malaria in the United States. There's really no reason to think that this Zika virus is going to come in and now spread widely here. So for most people in the US, it's really not something that they need to be concerned about. Now, where it does become concerning is if you are a woman who's pregnant and you go to visit one of these areas, you do need to be aware of this and you do need to be very proactive. If you can postpone or cancel those travel plans, that's what's being recommended by the CDC. If you do have to make those travels, you should take efforts to prevent being bitten by the mosquitoes in those parts of the world. So if you were going to go to Brazil or one of the South American countries where we're seeing a lot of spread of this, you should be careful. So you should be using mosquito repellent, wearing long sleeve, loose fitting clothing, trying to stay in a place where it has screens on the windows or air conditioning, things that we sort of take for granted. In some parts of the world they don't have those things. So you need to try to take all those precautions to prevent the mosquito from spreading this disease to you.
Now, other ways that it can be spread, you talked about microcephaly a little bit, sexually transmitted.
So there is some recent data and some not so recent data to indicate that this virus probably can be spread via sexual transmission, so male to female spread. There's never been any documented female to male spread. So we know, and this is again something that we learned with, for instance, with the Ebola virus, that the virus can sometimes hang out in seminal fluid for a longer period of time than it's in the bloodstream. And so there is some indication that a man can infect a woman with the Zika virus. So again, if you're a woman pregnant or you're trying to get pregnant and your partner has recently been to that part of the world, you might want to be careful for a little while. So if you're already pregnant, you probably should either abstain from sex or use a condom and use it appropriately and effectively for sexual activity. If you are not pregnant, but you're trying to become pregnant, you may want to postpone that for a little bit of time as your partner comes back from that part of the world. So these are kind of some common sense things that people do need to be aware of and informed of and take those precautions. Now, we don't really know. One of the mysteries of this is we don't know how long the virus can stay in seminal fluid. We think it's probably a matter of a few weeks, but to play it safe, I would recommend probably waiting for somewhere in the 1 to 3 month range, using condoms during that period of time before that, but then probably after that you're probably okay.
Okay. Let me ask, so Zika virus, Ebola, what other types of infectious diseases are you dealing with currently in your role there at the med center, your day-to-day, just trying to get an idea of what that looks like for you?
Sure. So we're not seeing some of these exotic diseases that we're talking about today. Again, people need to be aware of these, informed of them, take appropriate precautions, but we're dealing with a lot of more garden variety sort of things. So within our hospitalized patients, we see people coming into the hospital sometimes because of infections, whether it's a severe pneumonia or an infection related to some other condition that causes hospitalization. We'll obviously get involved with those sorts of cases. We are very proud that the medical center has a very successful transplant program. Now, because of that, we have a large pool of patients that are immunosuppressed, either because of the medicines that we put them on to suppress their immune system or other treatments, so they become much more prone to infectious diseases. And so some of my faculty members actually specialize in taking care of those groups of patients that are more prone to infections. So those are just some of the examples. Other things that we're very active in working on is trying to prevent infections in people who come into the hospital. And then another thing that we may have talked about in the past is the overuse of antibiotics and all the downsides of that, whether it leads to resistance or side effects or toxicity. And we have people at the medical center who are trying to make most sense of how to use antibiotics wisely. So there's just a lot of very, very talented and smart folks in the division that are working on infectious diseases at a lot of different stages.
I think as long as we have you here in the minutes that we have remaining, it would be a good idea for us to speak to the viewers across the state. From your vantage point, when it comes to your area of expertise, what is probably the number one thing that folks can be doing in order to avert ever having to meet someone like you, right, in terms of that particular area?
Sure. So I think that prevention, ounce of prevention worth a pound of cure, right? So doing the things your grandma told you, getting enough rest, getting a moderate amount of exercise, staying in shape, keeping your body as tuned as you possibly can, obviously helps you either prevent the infection on the front side or helps you fight it off if you do contract it, on the other side. So a lot of preventative efforts in that regard. Again, prevention through vaccination, I'm a big proponent of that. Clearly we saw that just a little bit ago with measles outbreaks that were associated with people not necessarily taking those precautions that they should. Those diseases will come roaring back on us if people don't maintain the protective levels of immunity through vaccination. So these would be some of the things that people can do, that your viewers can do, to try to prevent having to come and see me.
Yeah, so why aren't folks getting vaccinated? I guess I can come up with a few reasons that I believe they might not be doing that. I know that there was some concern at one point about, well, we don't really know what's in that vaccine. So why aren't they getting it done? And here's your opportunity. What would be your push to try to get them to maybe change the way they're thinking about that?
So I think there is a lot of misinformation out there about vaccination. These are clearly proven to prevent diseases, to be effective, and to be safe. So there's a lot of misinformation out there associated with vaccines and some possible side effects or toxicity that are generally overblown and pale into insignificance compared to the diseases that they prevent. Now, some of these diseases, the people come and they say, well, look, they're so rare now, the vaccines have been so good that I don't need to get vaccinated for it. And that would be true if everybody else got vaccinated. But unfortunately, we're all having to work in a society together, and we do need to maintain that herd immunity so that we protect everybody. Because there's some folks who can't get vaccinated. They either have allergies or side effects or some other contraindication to getting vaccine, and we have to protect them by having everybody else vaccinated. So I think it's part of being a good citizen, being a responsible person, doing to others what you would have done to you, just helping society in general. It's part of the price that we pay to live in a society that's free of infections.
Okay, so recap them for us then, Doctor. The vaccines that are the most important that every adult, barring any unforeseen thing, should be considering would be what, and what time of year would they be thinking about getting it done?
Well, there's a whole schedule of this. So again, if people go to the CDC site, they can go to a very well-informed source of information to tell them what vaccines they should be getting at what schedule. So there's always, obviously, all the childhood vaccines, so diphtheria, measles, mumps, pertussis, those sorts of things. As adults, sometimes we forget that we need to be vaccinated as well. Right. So one of the vaccines that we're trying to get people to understand that they need to take is what we call the Tdap vaccine. So this is tetanus, diphtheria, and pertussis. Now, some of these diseases we think of as kind of childhood diseases, but unfortunately what happens, particularly with the whooping cough or pertussis, is that it's the older people who give that to the infants who then die. And so to protect our grandchildren, older folks should be getting that vaccine. Hepatitis vaccine for certain persons, a yearly influenza vaccine I think is important, pneumococcal vaccine, shingles vaccine. So all these are vaccines that adults should be getting at certain stages of their life to help prevent those illnesses. Unfortunately, to bring it back to the topic today, we don't know enough about Zika virus. We don't have a vaccine for it. But one of the things that's coming up now as we're focusing our attention on these viruses is that we do have developmental efforts now in place to start to work on those vaccines. So this is a great message for everybody about, what do we need to learn from these outbreaks? And one of them is to be prepared, to be working on these diseases in the background, because you really just don't know sometimes how they're going to come to the fore. Zika would be a perfect example of this. So there now are some efforts underway to develop a vaccine, but this takes years. So we're not going to have anything that comes to market anytime soon that will help protect our travelers. And so instead, they really need to be relying upon those preventative efforts to prevent their mosquito bites.
Okay, and final thoughts from you then, of course, talking today about the Zika virus, which led us down that path. Final thoughts in terms of reaching out to a large number of folks, which we do with the program, coming from where you sit. What's most important or important for us to know as we leave this particular program?
Well, I think to tie this all together, the Zika virus, like Ebola, is a perfect example of why we need to stay poised for emerging infectious diseases. We don't really know where that next outbreak is going to occur, whether it's going to be something very serious like Ebola, whether it's going to be something potentially less serious like Zika. But the one thing I can say with a fair degree of assurance is that we will have another outbreak. Is it going to be a serious influenza outbreak and a pandemic, or is it going to be something else? So that's why we have to stay poised. We have to have a very active, vibrant, well-resourced public health service so that we're able to do surveillance for these diseases, to take action when we see them, whether that be quarantine or vaccination or medications, to try to keep them at the lowest level possible.
Thank you. Great advice. Thank you so much for being here to share your time and expertise. We appreciate it.
My pleasure.
Thank you, you bet. And thank you all for watching. We'll see you next week.
Issues and information program produced by UNO Television. More information can be found at unotv.unomaha.edu. If you'd like to share your comments about this show, call UNO TV at 402-554-2516 during regular business hours, or email us at considerthis@tvmail.unomaha.edu.